This product-service system is concentrated on improving health outcomes for rural subcontinent Indians focused on the state of Bihar, in which small hospitals lack effective systems to safely dispose of waste appropriately to allow for a sustainable way of life. Hospitals generate infectious waste in addition to items such as paper, cardboard, and food waste, which can be composted. Due to the lack of segregation, recyclable items are being mixed in with infectious waste and dumped into open bins on roadsides. In some instances, it is collected by rag pickers who sell it back to hospitals, and unauthorised reuse of waste is occurring due to the lack of funds. During the establishment of health institutions in this state, there was no consideration made into how waste was going to be managed. 80% of hospital waste isn't hazardous, but is mixed in with hazardous waste. From this, the concept of a worm farm as part of a hospital's waste management routine allows for the reduction in the amount of waste going to landfill. In addition, it generates knowledge of sustainable ways to carry out waste management. A worm farm can compost items such as paper, cardboard, food scraps, and blood-soaked cotton bandages. When considering the materials that were going to be used to make the worm farm, it was decided that it would be made from either recycled materials or at the end of life stage, the materials would be able to be recycled. The product is received disassembled and is then assembled by the employees. Waste is then separated into bins to ensure that it is not contaminated with infectious waste. Each day there is a new worm farm used so that the waste can be processed by the worms. It results in there being up to 14 worm farms being used at the one time. Liquid fertilizer is extracted through the valve at the bottom daily and collected to sell to farmers for their plants. Once the 14-day process is complete, the worm farm is then emptied to begin the process again, and the worm castings are sold to local farmers. An income is produced for the hospital from the liquid fertilizer and compost that can be used to purchase essential equipment.